I'm super excited today. We have Noa Mintz, the CEO and founder of Liby Health. Noa has an amazing, incredible background and also is building an awesome platform that I'm super excited for her to share more. So, Noa, do you want to just maybe give a little bit of background about you and like your entrepreneurial journey as also a second-time founder?
Sure. Thank you for having me. So I'm Noa Mintz. I'm from New York. As Nina said, I'm a second-time founder. My background is in childcare, actually. My first company places nannies with families in the New York tri-state area and has grown since we started almost 12 years ago, more than 12 years ago. And my background afterwards was in clinical research and healthcare innovation and health tech. And after working for some Israeli health tech companies, I ultimately realized that there was a real need for patients who had been critically ill in the hospital to get more digital support and have some kind of infrastructure to help them acclimate from the ICU, intensive care unit, to lower acuity care to home. And I sought out to build that infrastructure at Liby Health, essentially the first company that's building the post-ICU survivorship platform.
Amazing. So, I guess if you can explain what Libby is, what's the essence of Libby Health, how would you explain it?
Sure. So at its core, the problem we're trying to solve is reducing readmissions and deterioration that patients face and their families ultimately face also after they leave the ICU. What that looks like in practice is a few things. So right now we have early AI companions that are meant to be used for health coaching to help patients make better decisions, pull in different data and reconcile what's happened to them. That's one arm. The other arm is our smaller kind of division, which is support groups and online courses that are meant to reacclimate patients back that are not very technologically savvy, but allow us to really understand the patient experience, what material people are engaging with. It essentially provides us with some kind of lab to iterate with without having generative AI tools in it. The third one is a digitalized clinic that includes this post ICU clinic model, but with AI, with human in the loop as well. That includes kind of functional recovery, physical recovery, emotional recovery as well, with consults, with check ins, and whatnot. So we have three kind of arms that we're building out in parallel, some of which will require more capital than others, which is also intentionally why we have these three channels at once.
Okay, awesome. So, Noah, can you share a bit more of why you wanted to solve this problem, why you started Libby?
Sure, I've always loved a real challenge, and this is by all means a real challenge. And as I got more familiar with the digital health landscape, I realized there's so many amazing technologies that exist. Wearables, nearables are a newer thing to kind of monitor someone in their home. You have amazing digital biomarkers that exist, phone apps, things that, I mean, unreal things that we couldn't even imagine 10 years ago, using our eyes, using temperature, etc. And a lot of times, both these monitoring technologies and also interventions that used text and generative AI also weren't including the higher risk patients. And I realized that when I was looking at the kind of critical illness space, we were finally starting to see more and more digital health tools entering slowly the ICU, inpatient wards. But once people leave the hospital, they're still left out of these programs. You see a lot of digital health programs that include counseling and monitoring for people with asthma, diabetes, whatnot. But there wasn't exactly something that was looking at this post-ICU patient population in general. And to be clear, there's actually post-intensive care syndrome. So patients who leave the ICU are actually at a much, much, much higher risk of various different disorders, including like cognition issues, physical impairments, functional issues, high readmissions, higher mortality. So it was clearly an issue that needed to be fixed. And what we were seeing was a lot of the um, brick and mortar traditional ways of helping patients wasn't reaching them because they couldn't access appointments. Hospitals weren't seeing revenue driven from them. And so it seems like a perfect issue, perfect kind of space for digital for two reasons. One, because digital is more scalable, but two, because of these patients' conditions and how difficult it may be for them to get to care, it actually made more sense to bring the care to them. And that's what having some form of digital care allows. So, on multiple levels, it seemed like the appropriate time and opportunity to bring some of these digital innovations, digital care models, telehealth, AI to this patient population.
So amazing. And can maybe you want to talk a little bit more about like where's the platform at today? Like where are you guys at in terms of building?
Sure. So we have our AI tool in beta that we pilot with researchers. We're being really intentional of how we're bringing tools to patients because, as I said, these are really, really high risk patients, and the stakes are high. And we're pretty values driven in that we don't want to give something that's pre-baked that could actually um, cause harm to a group of patients or to anyone for that matter. So because of that, currently our AI tools are in beta testing with research collaborators. And then in parallel, while we do those kind of that rigorous testing, we also are providing these courses, support groups, and uh, other like digital tools for patients that are already established, built, and based on existing care models and guidelines. And so the hope is that eventually the two will converge once we feel that we're in a really good spot and that these tools have been rigorously tested in controlled trials, and that they're ready for, prime time. We'll also have really understood these patients better and how we can help them instead of making assumptions through our work with them at the moment in parallel. And we can bring the two together to have these kind of end-to-end supports that include the ICU clinic, the digital clinic, that include our courses, but also nudges that are coming from the AI tool and whatnot. So it becomes a whole ecosystem that also integrates with existing care. And so, as a matter of fact, our current efforts with patients are directly with patient groups and patients. However, once we have an ecosystem, the hope is that we'll be embedded with a payer and health systems themselves, to be an extension after the ICU and taking responsibility for the patient from that point forward.
Amazing. And what would you say is on the horizon for you guys? What's really top priority and top of mind in terms of the roadmap?
I think what's most important right now is we know there's clinical need, but in healthcare, you have to save money for the organization you're helping or generate revenue because of the way things work. And so, therefore, we're trying to tie this clinical need that we know exists to these market drivers to really make a compelling story. And so we know which of those variables would be compelling to our potential customers, but it's connecting each as we do this testing and iterating to say, hey, actually, instead of X being the KPI, it might be this, so that we have a full story that includes really helping patients, really helping health systems, payers, and everyone in the ecosystem. But that's a really big task, and that's why we have multiple channels at once, so we can have multiple signals that we're internalizing and pivoting on, to build something quickly, safely, and smartly, for the healthcare system and for these patients who deserve better.
Okay, amazing. And also, Noah, I think it's really important for everyone listening to know is that you are a second time founder and an entrepreneur, very like young, ambitious entrepreneur, which is so cool. I'm curious, like, what have you taken away kind of from your first venture, in which you've learned and applying it like going forward for Libby?
So I think the thing I learned from my first venture is that you have to know how to take advice and make decisions in the right way. And that sounds really simple, but what I mean is you see a lot of entrepreneurial advice that's like hustle, 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 go quick. And then there are times where if you take that advice wrong, for example, releasing a generative AI tool for vulnerable patients, that's actually not a good thing. So thinking about how you take advice and when you take advice is really important, because part of the work you do as an entrepreneur is taking a bunch of signals and noise and finding which ones are signals and which is the signal that you need to hear most because you have a sense of what your users need, how you can do this. And so not everyone will be on the same wavelength as you when you speak to someone, whether it's an investor, a potential customer. You have this unique position of speaking to all of them. So synthesizing and taking in all the advice and then being really pragmatic about which advice you take when and how and to what extent. Even if someone is super qualified, has done something similar, contextualizing the advice you're being given before running with it.
Amazing. Yeah, I absolutely love that. So, as I mentioned before, there's a lot of people in the ecosystem that would be listening to this, whether it's investors, operators, other founders. So, what for anyone that would be listening, what could they do to support Libby?
So any support or sharing our story is super, super appreciated. Right now at this stage, we're excited to work with more and more partners, whether that be researchers, clinicians, health systems in the US or elsewhere. But right now our focus is really on the US, to test out these amazing tools that we've built, as we continue to also work with patients directly. So if you either are in a situation where you have infrastructure to do research with patients, or help us better understand our customers as a health system or as a payer, we would love to talk to you and share what tools we already have built, what we're currently building, and get in this early stage where we can also really build for our early customers, based on your workflows and the specific issues that your institutions are facing. And to that end, we're not currently fundraising right now, but I'm always trying to think about what's next and what I need to build so that it's fundraisable and compelling to investors, not just our customers. And so to that end, I love and welcome connecting with any VCs, institutional investors, angels who are interested in the healthcare space, because I'd love to learn from you and share what I'm building, and I'd love you to follow along, as we have progress and keep building.
Amazing. I'm so excited for you, and I can't wait to see everything, that you're able to achieve. So anyone listening, if you want to get in touch with Noah, feel free to reach out, and you'll definitely want to learn more about Libby. It's an incredible platform that Noah's building. So thank you, Noah. I really appreciate joining today.